Hi friends, welcome to Plexus Ortho. My name is Dr. Kannan Kumar and today we are going to discuss an MCQ that we put up a couple of days ago in the Telegram channel. So the MCQ number was 228. So the MCQ was, which of the blood vessels of the following blood vessels supplies the outer one-third of a long bone, right? So they are dividing the long bone into thirds, outer third, middle third and inner third, and they're asking you what supplies the outer one-third. Very carefully read the question. So outer one-third of the long bones are supplied by what is called as a periosteal vessels. Okay, so we will go into a little bit more detail into the blood vessel supply of a long bone, right? So 5 to 10% of the cardiac output is given to the bones. Okay, there are multiple bones in the body which have poor blood supply. They have finicky blood supply, tenuous blood supply. Some of the bones that we know of are scaphoid fractures, of course. So we have seen in previous videos that most common scaphoid fracture is at the waist, but the most common region that can go into AVN is the proximal pole. Why? Because the blood supply is dorsal and distal. So once the fracture happens in the more proximal region, the blood flow does not come in through, and therefore there is a higher chance of avascular necrosis. Remember that. Talus also has a poor blood supply. The common theme between these two is that most of the bone is covered by cartilage, and therefore there is not enough muscular attachments, or there is not enough ligamentous attachments for the blood supply to go in, right? So therefore there are more than 80% articular cartilage, both these bones, and therefore they have a higher chance of going into non-union. Femoral head, all of us know, very high chance. Neck of femur fractures have a very high chance of going into non-union because the blood supply is extracapsular, right? Number one. Number two is the fracture is intracapsular, and therefore it is bathed in synovium, and there is a less chance for healing and hematoma formation. So the stages of fracture healing is poorly defined or forms poorly in the fracture neck of femur, and therefore it can cause go into non-union. Odontoid fractures, right? They can also go into non-union. They have a watershed region where the blood supply is poor. Base of the fifth metatarsal fracture is also known as Jones fracture. These fractures are also very commonly known to undergo non-union because they have poor blood supply. So these bones you must remember because they may be asked in various forms in your NEET entrance exam. Scaphoid bone, talus, neck of femur, odontoid, base of fifth metatarsal. These are some of the bones that are having poor blood supply and have a higher chance of going into non-union or avascular necrosis. Right, coming back to the blood supply of the long bone, there are three groups of blood supply that can enter and give blood supply to the long bone. The first and the most important one is the nutrient artery. It enters anywhere in the long bone, right? Then it enters into the medullary canal and divides into the ascending branch and descending branch and supplies most of the inner portion of the long bone. So it supplies the inner 2/3 of the long bone, right? So nutrient artery enters, pierces into the long bone, divides into ascending and descending arteries, and gives supply to almost up to 2/3 of the inner part of the long bone, right? It has a high flow system because the arterial pressure is very high compared to the other two blood supplies for the long bone. This has a high flow system. Okay, remember that. The second blood supply group is from the periosteal arteries. It supplies the outer one-third. It supplies the outer one-third of the long bone. Okay, the inner 2/3 is by the nutrient artery, the outer 1/3 is by periosteal arteries. So there are vessels which go along with the periosteum and supply the outer 1/3 of the bone. Remember this. Both these vessels are important for fracture healing and other purposes of bone metabolism. So the third group of system is the metaphyseal and epiphyseal system, right? So this is at the level of the metaphysis and epiphysis. We all know that at the level of the metaphysis, they form rings. The arterioles form ring-like structures at the metaphysis. There is a sludging of blood, slowing of blood, and therefore in the metaphyseal region you have what do you have? Increased chance of infection because of sludging of blood at that region, right? So these are some of the things that you have to know and understand about the blood supply of the long bone. So there are three systems. One is the nutrient artery, which supplies the inner 2/3, periosteal artery, which supplies the outer 1/3, metaphyseal and epiphyseal system, which supplies the epiphysis and metaphysis, and of course specifically the growth plate is supplied by what is called as perichondrial artery, right? And it is a part of this system, metaphyseal epiphyseal system. So it is called as perichondrial artery. It's a part of this system, right? Now let us see what happens if there is a fracture, right? If there is a fracture, then the normal blood supply is centrifugal, that is from inside to out. So if this is a cut of the axial section of the bone. This is the cortex, and this is a cavity. So nutrient artery is coming here and it's supplying the inner 2/3 of the cortical bone, right? And the blood supply here is from in to out, and therefore this is called a centrifugal, and this is a natural system because the pressure in the nutrient artery is higher than the periosteal arteries. However, in case of fracture, this nutrient artery is disrupted. When it is disrupted, the blood supply is more from the outside to in, which is called a centripetal circulation, and this is a low pressure system, right? So this is the difference between the inner nutrient artery, which is centrifugal, and outer periosteal vessels, which are centripetal, right? So this is the inner nutrient artery is affected in a fracture. So the healing process has to take place through periosteal vessels, hematoma formation, and you know all the stages of the fracture healing. So let's go back to the question. The question asked what supplies the outer 1/3 of the long bone, and the answer is very clearly periosteal vessels. If they had asked inner 2/3, then it is nutrient artery. If they had asked metaphysis or epiphysis, is metaphyseal epiphyseal system. Okay, so this is in brief about circulation in the bone. Thank you very much. My name is Dr. Kannan Kumar, and this is Plexus Ortho.